Hi, my name is Kel and I'm a therapist and educator with a special interest in eating disorders. Come on in, take a seat, and if you haven't already, don't forget to subscribe for bite-sized content across the mental health and eating disorder spectrum. In today's video, I'm going to be talking about eating disorders in relation to the COVID-19 pandemic. My last video was actually about some of my thoughts and reflections on being a therapist and working throughout this past 2 years. And a colleague of mine reached out and asked why had I not made a video about specifically individuals struggling with eating disorders and the impact of the pandemic upon them. And honestly, the answer to that question is that it had been an intentional decision of mine. I felt like we have spent the last 2 years very much focused on the pandemic, and I didn't want to add more conversation about that. However, I absolutely see that that is a little bit short-sighted, because the reality is, as you might have seen if you'd read any of my recent blog posts, is that eating disorder instances are higher than ever, and you will find that within the field it's being referred to as the pandemic within the pandemic, or the epidemic within the pandemic, because we really are seeing significant, huge increases in people coming forward who are struggling with eating disorders. I know for me personally, in terms of my own private practice, pre-pandemic, people typically waited only a few weeks in order to get an initial appointment with me, whereas at this point I'm unfortunately having to leave people on waiting lists for around about 6 months, which is really not something I'm comfortable with doing, not something I want to do. But there isn't even many options in terms of referring people on, because all of those of us working in this arena are finding that that is a situation, that there's just not enough of us with a specialist knowledge to support everybody who is struggling with an eating disorder right now. And I guess if we could rewind time and have the knowledge before the pandemic came that COVID-19 was going to happen, it probably would seem not that surprising that we're seeing such significant increases in cases of eating disorders, because at the core, for the majority of individuals struggling with an eating disorder is a coping mechanism. It's a way of dealing with difficult emotions, a way of dealing with uncertainty, a way of feeling steady, and for some people, and if that term in control gets bandied around, doesn't it, in relation to eating disorders. And if we look at this past 2 years, if you think about perhaps the life of an individual that maybe even just a few weeks before the pandemic was going about their regular life, going to school or university or work and spending time with family and friends, and had, I guess, a typical experience of life today, or life as it was 2 years ago, we could see that when lockdowns happened, and of course they happened here in the UK in mid-March 2020, that life stopped. Literally overnight, life stopped. We went from having the choice to live freely to having the majority of our choices taken away from us, and the majority of our coping mechanisms taken away from us as well. And we were thrust into an environment for many people, particularly people who live on their own, where we had immense amounts of time alone with our own thoughts. Many people tell me that they spent significant amounts more time on social media and consuming social media. We had lack of access to social support. For people that were already struggling with their mental health, support services were not prepared to come online and start working online, which thankfully the majority of them are able to offer now. But that would have meant that support, if it was already being accessed, was literally unavailable, immediately unavailable. And then there's this massive feeling of uncertainty. What is this? What is life going to be? What's going to happen? And for some people, there's also been the factors of the virus itself, fears of becoming unwell, fears of contamination. You know, we really, at least in the UK media, saw some publications talking about the need to wash food and be cautious about food in that way. And for some people, that really fed into processes that became eating disorder processes. So it really is multifaceted. And as you will have heard me talk about almost any time I talk about the causation of eating disorders, it's never one thing. It's never one thing for an individual, and it isn't one thing across the board. So each individual's experience of struggling with an eating disorder is different. But what we have seen almost universally throughout the pandemic is that people's eating disorders seem to have got worse faster, and people are presenting with more severe medical sides to it, so their body is struggling more, and the trajectory of the mental aspect getting worse has happened so much quicker. And of course that makes sense because we've had all of this time to ourselves and to our own thoughts, and there was also a good amount of focus, if you were consuming popular national media, around fitness, and lots of people talking about cooking healthy and trying to get people involved in that. There was literally breakfast TV, giving fitness classes in the morning to keep people moving rather than sitting on the couch. And there really could have been more conversation about the need for us to better take care of our emotional well-being in that time, as this massive change happened to us, rather than that overly focused effort on our physical health, because I suspect that to some degree that was an element for a good number of people who have struggled and developed an eating disorder in this last year. This month I've actually noticed that one of the eating disorder journals has published a couple of articles in relation to eating disorders and COVID-19. There's been quite a few publications in the past 2 years, but of course as time goes on that gives researchers the opportunity to have conducted more longitudinal studies and to see the longer term impact. I'm going to leave the link to the most recent articles that I read down below, which in general they were suggesting that probably about 40% of people who are currently reporting eating disorder type symptoms have not sought a diagnosis, and around half of people have not yet come forward for any support, any ongoing support, any talking therapies or eating disorder treatment services. They're not accessing that help. And given these huge waiting lists that we've got right now, that's pretty concerning from my perspective. If I think that my waiting list has gone from maybe a month to 6 months in that time, and potentially only half of the people that need the help are being cared for or are on waiting lists at the moment, that really feels like a scary place to be over the next few years. And that is also not accounting for those people who weren't included in that research, because of course you need some awareness that you're struggling with an eating disorder in order to indicate that when being asked a research question. What this really is going to mean is that therapists and other health professionals are going to really need to be educated in eating disorders. Eating disorder education is not a standard part of training to be a therapist, as the majority of you watching this will already know, but it isn't a primary focus of the majority of healthcare courses. So GPs have exceptionally limited training in eating disorders. In the majority of universities, even mental health nurses don't get a huge amount of experience unless they go on an eating disorder related placement. And all of these people are going to find themselves, based on these statistics, are going to find themselves working with individuals affected by eating disorders. And if you're watching this and you're thinking, okay, I'm interested in learning a little bit about eating disorders, but I'm not necessarily explicitly intending to work with clients with eating disorders, I think in all reality, we haven't got much choice. You're going to find yourself with people who are struggling with their relationships with food or with their bodies, or using either and or both of those as a way of coping, on your client lists because of this massive increase. And to some degree, if those of us with additional knowledge in this topic don't upskill those of you who don't have very much knowledge in this topic, people are going to be sat on these 6 months plus waiting lists for some time to come. And that just doesn't seem fair. If we can offer a small amount of education, which we're obviously starting to access by watching this YouTube video, that can mean that people get support sooner. For the entire of the time that I've had anything to do with the eating disorder field, we've been saying that early intervention works, that the sooner somebody accesses care, the better. And yet we're now in a situation with more cases than ever, with more severe cases than is typical, and therefore that access to support right at the point of need is going to be being pushed off more and more, which is going to mean that as time rolls on, if we don't do something about this, we're going to see that medical needs are greater, that the need for hospitalizations has already increased. I'll link to the blog post where I wrote about that. And it really isn't good enough. I get that therapists are often scared about working with those affected by eating disorders, but we really have a duty of care to have knowledge about the things or about the ways that we can support people who are struggling with a condition that really is this pandemic within the pandemic right now. So I hope that this video has been in some way helpful. If you're interested in specific aspects of eating disorders in relation to the pandemic, I guess I will suppress my desire to not make content about this and answer those questions. So feel free to leave me some questions about this in the comment section below if it feels like it would be helpful for me to explore this topic further. If you're a therapist or anybody working in health and social care that's interested in learning more about eating disorders than I can offer you in these videos, head over to my actual website, mentalhealthbites.co.uk, and subscribe to the CPD mailing list, which will let you know about training events that are coming from me in the coming year. There is not any available at this exact moment in time because I've been focusing on some other exciting projects, and I've been focusing on creating content here and through the blog, and I've also been obviously spending quite a good amount of time with my clients as well. But hopefully come the next quarter of the year, there will be some options for courses both online and live for you to take part in. So if you go and hop over to there and subscribe to the mailing list, then I will be able to directly email you and alert you when new courses are available. And while we're on the topic of subscription, don't forget to subscribe to this channel so that you get videos straight into your subscription feed. I really appreciate all of the support. Until next time, be kind, be curious, be yourself.